Remarkable women from across the country
I'm just a survivor that's not going to give up.
help shine the light on their incredible stories.
I didn't survive to sit on my story.
125 trailblazers will be honored and could win $25,000 for the nonprofit of their choice, plus a trip of a lifetime.
This doesn't happen in my life very often.
Hey, did you know that March is Women's History Month? And you know, here at NewsNation, we love sharing stories that matter to you. News for all Americans. And right now, we're sharing an inspiring story as part of our Remarkable Women Initiative. Let's welcome on in Dr. Collette Adamsen. Dr. Adamsen is working to help the lives of Native Americans in her community and really try to improve their lives. Thank you so much for joining us, and congratulations on your Remarkable Women nomination.
Thank you so much. I appreciate it. It's an amazing honor to be nominated for this, and I'm just grateful to be here today.
How did you become so passionate about improving the lives of Native Americans in the United States?
It all started growing up in Turtle Mountain Band of Chippewa tribe, which is my tribal community. Growing up, we were always encouraged by the elders in our community, in particular for myself, my grandparents. My grandma always pushed education for her children, my mom, my aunties and uncles, and we just went forward with going off to school and trying to go as far as we can. I wanted to work for my people and try to help give back, especially to our elders, because they are the ones who helped to make me who I am today. And my family always said, God has a plan for you. And this was his plan. And I had applied for a job about 10 years ago with the National Resource Center on Native American Aging. And I started off as the project coordinator.
What are some of the challenges that the tribal communities are dealing with today?
Our organization, our main project is we conduct a health and social needs assessment survey, particularly with our Native elders in the communities across the nation. And if you don't have data, you're pretty much out of sight, out of mind whenever it comes to our federal government and state governments making decisions about who gets resources or where funding is going to be allocated to.
What are some of those real needs that the tribal communities are telling you that they have?
We see that there's a lot of need for support services, home and community-based services, to be able to keep our elders in the community longer so they can age in place. And a lot of times our elders, if they do have to have that type of care, they're sent out of sight of our tribal communities, and they're away from their families and their support system within our tribes. So by being able to work with the communities to get those supports and resources in place in the tribal communities, then they're able to keep the elders and aging in place longer within their communities with their families and the tribe itself.
Yeah, you want to be around people that you love, that care about you, that know you. So Dr. Adamson, what are some of the transformations that you've noticed inside the community, whether that's nutritional, medical, mental health? What have you been able to see a real difference for individuals in those communities?
There's a real push to try to get these home and community-based services within the communities. So things like personal care, homemaker and chore services, essentially like caregiving services to our elders to keep them in their communities longer.
What are the real needs that you're seeing, and how are they accessing those services to improve their lives?
If those services weren't available in those particular tribal communities, then they would be sent off to a long-term care facility, or they wouldn't get these services and just basically go without, and it would have a detrimental effect on their health.
Dr. Adamson, what does it mean to you to be nominated as one of the Nexstar Remarkable Women?
Well, to be honest with you, I appreciate the nomination, and I feel very honored. I don't do this work for any recognition. Like I said, my elders inspired me to become who I am today, and I'm so grateful for their guidance and support. And so this is just my way of having the opportunity to be blessed to be able to give back to them.
And it seems like you have achieved so much in such a few short years. What are your goals long term for the great work that you're doing?
A few years ago, we were able to have a sponsorship from AARP to be able to expand our work with the tribal communities to our urban communities. And I have a great team who's dedicated and passionate about this work as well and are very committed. I also have the fortune to be able to work with Title VI programs, their directors and staff in this partnership. Those programs, those directors, those staff members in those tribal communities are wearing 10 different hats, and they're doing all they can for the elders.
Well, teamwork makes the dream work. I'm sure they'll be appreciative that you acknowledge them as well. Dr. Collette Adamsen, thanks again and congratulations on your nomination.
Thank you so much.
And to find out more about our Remarkable Women Initiative, go to nexstar.tv/remarkable-women. For NewsNation, I'm Anna Kooiman.